item on the agenda for acceptance of the minutes of the February 5th meeting. Do we have a motion to approve the minutes of the February 5th meeting as sent?
Motion approved.
Second.
Approved. The next item on the agenda is an introduction of Dr. Russell Coleman, the new Health Department medical consultant. We welcome Dr. Coleman to the Health Department staff, and Dr. Coleman's just going to have a few words of hello.
Hi, good evening. Thank you for having me tonight. Nice to meet members of the board. Just give you a quick biographical sketch. So I moved here to the Boston area in '97. I was stationed at Hanscom Field for 3 years there, and then I was recruited by Pediatrics West. We have offices in Westford, Groton, and Fitchburg, where I started there in 2000. Been there ever since. I'm second longest employee there. That's not a good thing, but anyway.
Can I ask you to use the microphone?
Oh, sure. I didn't know if it was on.
Audience?
Oh, sure. So I've been there almost 25 years now, enjoying it very much. I've worked with a number of schools in the area, including some of the larger schools, Groton School District, North Middlesex Regional District. I work with one of my NPs for Tingsboro, and I'm starting now as with you guys. I'm happy to be doing that. And what I've done with a lot of the schools over time is basically working on modernizing policies, updating policies, making sure things are consistent with state regulations as they change every couple of years, and also working very closely with the nurses and now the health department staff to be able to answer any questions. You know, COVID was a crazy time, spent a lot of time texting, phoning, messaging, making sure staff are updated on all the new policies, procedures, and I think that, you know, for you guys to have somebody who you can call on when you need me is a very good thing. You know, they've got my email, my mobile number, and basically available, well, let's call it 18/7. Any questions from the board?
No, we're excited to have you. Appreciate you being willing to join and do the work for us.
No, thank you. Appreciate having me here tonight. Thank you very much.
Welcome aboard. Nice to meet you.
Thank you.
Thank you.
The next item on the agenda is the monthly development services report submitted by Matthew Sheehan.
Good evening, everybody. As you can see the report in front of you, we had 5 new businesses that opened up in the city since our last meeting. We had 1 fire out of Middlesex Street. That store is open and operational now. We had 3 establishments that failed during this reporting time. All have passed the previous inspection except for the very last one, which is Northwood Rehab out of Arnhem Avenue. And Winterfest was a success on our end for our team.
Can you elaborate? I mean, is this, when you say a call was placed at DPH, was that you? Was that your team making the call?
Yes, sir. I made the call. Besides what I have listed here, there are some issues with the facility that are outside of our purview, but they are finding it tough, and this is coming from staff that, you know, wanted to remain nameless, that bills aren't being paid. So having to get contractors out there is slowly starting to become an issue. Now it's starting to become an issue to our team. So we are doing our best to work with the facility, but I felt it necessary to just let the state know what was going on in case something got bigger. I mean, the bottom line is it's financial.
So when are you going back out to re-inspect them then? Are you going to be going back out?
A week, maybe
Another
2.
week, so? Okay.
But I'll make sure I include it in the next meeting's report. And if it happens to grow longer legs, I'll let the board know right away.
Okay, thank you. Okay.
So the list of inspected facilities was much shorter this month.
Yes. So, I mean, it's a love-hate relationship with Excel. I do not like Excel, so I had to shrink it down a lot for whatever reason to get it on this page this time. So it looks a lot less, but it really isn't. It would be the normal, I guess, font, if you want to call it that. It'd be over a page.
Oh, okay.
Yeah.
Okay, I've never counted them. They've never been numbered, so it's hard to
No,
tell.
this, I mean, like I said, this list, it just, like I said, it's the font, it's, because 1, 2, 3, it's the 6th column where I put everybody's names all the way at the end. For whatever reason, I couldn't squeeze it in this time, and I had to make everything smaller, which makes the list look smaller.
Is it sometimes landscaped versus,
Like the landscape versus portrait thing?
yeah?
Yes.
Okay, that's why. It sometimes is a different,
When you send it to me, I turn it so it's landscape, and then I do fit all the columns on the page. I'll show you how to do it.
Okay. Like I said, it's an extreme love-hate relationship with Excel.
Yeah, you gotta play with the
How many do
margins a
they
little
do a
bit
month
too.
usually? How many do you do a month usually, inspections?
I mean, it depends, because food inspections are every 6 months, so I would
On
probably
average.
say 20 plus.
Well, there's like 40-something on this, but,
Right, but to your point, not short-staffed, there was no
absolutely
change
not,
in your
no.
normal
Yeah,
routine,
no.
this is just everybody that's due to have it done.
Oh, absolutely, 100%, yeah. It's just, it's the way that it came out this time that it looks short, but it really isn't.
yeah. I'm glad you brought up the 6-month thing. There are a couple of places, Dunkin' Donuts and Hong Kong Market, that were 11 months for some reason, since their last inspection.
Yeah, I'll check into that.
Okay.
I'll definitely look into that, but it shouldn't be like that.
Okay. I just wanted to make sure there wasn't any reasons for that. Anything else from the board? Questions, comments? Anything from you, Matt, that we need to know?
That's all I have.
Okay, great, thanks.
All right, thank you,
See you
everybody.
next month.
See ya.
Thank you.
The next item on the agenda is the Pride Star reports and notifications. Mr. Kelly? And, what's the other guy's name?
Hi. So I think you all have the January opioid report there,
Yep.
which was, so when we did the reporting, the guy who does it, Joe, he called me home and he said, I think I've screwed things up. The numbers were so low.
Yeah.
We came in Monday, we did it again. We went back to 2022 because we thought we screwed something up with the numbers, but it was just the 911 volume for overdoses had fallen that much.
Wow, that's great.
Yeah, it was really tremendous. On the second packet, we had made a kind of a year in review report. That's the Pride Star Trinity report to the city of Lowell. The top of it is a recap of kind of the last 13 years or so, from 11 to 24. It shows the Narcan saves per year, the totals. You can kind of see that journey we were on through the apex of the epidemic in 2018 and 19. And, last year we had 460 overdoses in the city, opiate-related calls, which is the same that we had back in 2014. I think, there's a lot of reasons for it. I think a lot of hard work by people in the city. It's paying off. There's a couple stats over there. You can kind of see, 30% less than this, Then we broke it out by kind of area of the city, inside, outside, right? So an overdose in the public space has a different impact on public health than an overdose in someone's home. And then we kind of broke it out down at the bottom by day, by hour. You can kind of see what's, kind of the rhythm of the overdoses in the city.
Is residential institution, what is residential institution?
The cell block.
Got it, thank you.
Yeah.
Interesting wording, I like it, yeah, great.
Yes. Yeah, that was Joe. That wasn't mine. He got a little clever with that one. Other things in the report that we're working with, so we've been involved with the Tough School of Medicine, First Watch, and us. I have a project for the last year. It's just finishing up. We've applied for another year of funding through the CDC. So we have that guy, Joe, who reads every report. He's read 15,000 opiate reports since 2015. And we go in and we categorize them, we do a bunch of stuff. And it's really only us that do that. So with the Tough School of Medicine, First Watch, we're trying to teach the machines how to do that. I know the machines. But, there's some computer scientists and data scientists at Tufts that are helping us design it. So right now they're up to about 94% accuracy. So the logic in the system can predict about 94% of the time what Joe would say happened. So the next evolution is, if we get the funding for that, we'll do another year. Right now it's just Lowell stuff. the plan with this is we're going to get 5 agencies from across the country that'll participate in the same thing and use that machine learning process to kind of judge how their stuff is doing too. So did we solve the problem just in Lowell as far as the machines, or is it ubiquitous across EMS everywhere? So like Riverside County, California will hop in and they do 1 million something calls a year, and it'll be different places around the country. So we're waiting on word for that funding through the CDC.
Great. Hopefully we still have a CDC. Any questions on the overdose report? Okay, I guess we can go on to the 2024 fourth quarter report.
Yeah, we kept doing the old style along with the new one. We ran into some difficulty with the new one. Remember we had talked about, we had that macro designed and built, and we were able to kind of go and pick out the fourth calls. I'm not 100% convinced that it didn't break. The numbers that you see, I think they're actually better than we presented them, but I couldn't prove it, so we wanted to make sure that we were cautious with it. So
Just to make sure I understand, which numbers are we talking about now?
So it's the newer section, so it's page 19.
Got
So
it.
the first section is the old style that we've been doing forever. We haven't changed that at all yet. That's the same way it's always been.
Right.
We started talking, we wanted to break out the
contract.
contracted
Yeah.
calls versus the others. You can see kind of the Q4. The volume, the overall volume stayed about the same. What ended up happening for us, which kind of hurt us from a statistic standpoint, was we had more instances of a fifth call, sixth call, like calls were being compressed. So the call volume didn't go up, but more instances of 5 and 6 calls happening at the same time. So if you look at the on-contract emergencies, that number dipped, but then when you look at the off-contract, that number rose. Right, so the same number of people called 911, we just had them call more at the same time.
As long as they're accurate, that's fine. Can I make I hate to even request anything of you for this one. All I'm asking is that this be the first page.
Okay.
Because this is the part this is the thing we're responsible for. The rest is great to look at trends, but this is what we're responsible for. So I would want that page 1.
Absolutely.
Thanks.
And then on page 21, we kind of talk about the over 12-minute, like those are kind of the risky ones. So those are the over 12-minute on the 911 contract. There were 2 that went ALS, but to be honest with you, they went ALS by essentially IV opportunity, really. So it ended up, there was our paramedic trucks we had sent on BLS calls, and they ended up treating the patient at an ALS level. So one of the patients was really intoxicated. So they started an IV, started some fluids, which again, normally you wouldn't bother to do, but since it was a paramedic truck that showed up, they did it. And then the heart palpitations transport, it's kind of in that gray color. We wanted to highlight those. That was like somebody in their 30s. It wasn't really a cardiac thing. I think they had too much Red Bull. But again, we sent a paramedic truck as the ambulance available, so they put the patient on a monitor.
So, I think we've talked about this before. The out of chute, like almost 30% of the calls, the reason that they take longer than 8 minutes for arrival is because of the out of chute time.
Yes.
And so are there any items that create that delayed out of chute time that can be remediated, or what are those reasons in the out of chute times? Or do you?
No, a
have
lot of it is overall workload of the crews, where along with every other EMS agency in the United States, we're not fully staffed. So we have people that do 60, 70, 80 hours. We would love to have more trucks on the road if we could staff them, whether it's for, calls out of Lowell General or the 911 stuff. So I think after a while throughout the day, you can kind of see them getting worn down, right? So it takes them a little bit longer to go. Generally, you'll see a longer shoot time in the winter too. So if the truck's in a base, right, in a building, they've got to put their jackets on, So it's that sort of thing. It is something that about 2 weeks ago, we kind of started an internal process. We're doing a shoot report daily that we send out to the directors and all the supervisors, and they're starting to have more and more conversations with the crews. It's something we absolutely realize, like, okay, this is something we need to highlight, and we have started to kind of do that. We tried some automated systems, and unfortunately, it didn't work, so we run that report every morning manually, and we send it out to the supervisors.
Okay. I did have one question on page 7. So, if you go across the top columns, quarter 1, quarter 2, quarter 3, should that last column say quarter 4?
Yes.
Okay,
Sorry, I didn't copy the field over.
okay. I just bring that to your attention.
Thank you.
And then, on page 8, on the intubations, so if you go across the Trinity Company total, says 1 of 1, and then Trinity Lowell,
My dyslexia kicked in. Yeah,
okay,
we're 11 out of 12 as a company, 1 for 1 in Lowell.
so those just switched?
Yes.
Okay. Okay, it's just
No, thank you so much. We'll make sure we update that for the next time.
for your records. I thought that was the case, but just for the record. Those were my only questions. Anyone else have any questions?
No, thank you, guys. Looks good.
All right.
Thank you very much.
great
Good
night.
to see you.
Is this what you're referring to?
No, this here, that should be the total.
Yeah.
Those should be switched. The next item on the agenda is the monthly tobacco control report. Any questions on the tobacco control report?
Drakeit and Chelmsford have joined BN for Credo. That's a good thing.
Chelmsford voted last night to ban Kratom? Great.
Yes. So Chelmsford has banned Kratom and Drakeit has banned Kratom, so 2. Yep. And we had a call today with with Marion Ryan, District Attorney, and in their meeting that they're going to do for the opioid task force, they're going to talk about banning Kratom for all of the area, everyone in the Middlesex district, and they're going to talk about supporting it at the state level.
Great.
So they asked how the Board of Health did that and how the process went.
The next item for information is the Central Mass Mosquito Control Project. Informational, just in terms of, we will continue to be a member of the Mosquito Control Project, and just attached is the budget. Any questions? Next item on the agenda is discussion about modification of the body art establishing permit fee. There was a discussion on the city council regarding a revision of the body art permitting fee. The recommendation was for it to go to $375 as of January 2026 and $500 as of January 1st, 2027. I think we talked about this before. If the board agrees, we'll need a motion to approve the proposed revision to the permitting fees as suggested.
What did we, were we going to 500 right away? And they wanted to do it more gradually? Is that what the change is? I just want to make sure I know.
Yeah.
Right? Okay.
Is that correct, Director Golden?
Yes, that's correct.
And was this at the request of somebody?
I believe so. I believe someone called one of the city councilors. After we had the public hearing, they didn't show up here. And then there was a public hearing at the city council that nobody showed up to, but somebody called one of the city councilors. So now we'll take a vote here. It will go back for a public hearing at the city council again. And then I think it's going to have to come back here for another public hearing again.
Okay.
Government at its finest. That's awesome. So are we supposed to vote now?
Yes, we'll
I'll make the motion.
we'll vote, and then we'll have to, the secretary will write a memo that we will send to the council that we approved it. Thank you.
So there's a motion on the floor to increase the body art establishment permitting fees. Do we have a second?
Well, no, just to be clear on the language, we'd already done that.
Yeah.
It's to amend the increase to reflect a gradual
Step-
increase
a
to
step
375 and then 500. As, just whatever's written here, right?
Right, so the recommendation from the city council was to increase the fee to 375.
It's to actually decrease it to 375 now.
500, I thought previously.
Was there an actual vote on that? Oh, okay.
The new regs.
Yeah, we already finished the regs,
Somebody
so.
called and said something to the
yeah.
council, so they're going lower for upcoming year. and
So
then-
the board can recommend 375 or 500, it's up to the wish of the body. Just to be clear.
Let's just be clear, we're not going to go back and forth with city council, so the answer is yes.
If someone needs
Okay.
that.
I make the,
So the motion is to wait,
how about we say adjust the fees to 375 for 2006 and 500 for 2027?
do we have a second?
I'll second.
Okay, all those in favor? Aye. Do we need a vote?
No, this is just a motion to send the letter if they say you.
Okay. Do you have a question? Under old business for review, we have a communication from EFI Global, the contracted agency that does the Pawtucket Memorial monthly surveillance for mold. Everything looks good. Does anyone have any questions? We do not have a Cashin's air quality report, correct?
That's correct. I have not had a report since November. I have asked twice for reports. I have not gotten them. So I don't know if that means that they're not working in that area and they're not testing the next area, but I will call, since I've emailed twice, I'll call Jim Dowd now to ask him for one for the next time.
Okay, can you put a note?
So we may get December, January, February, March. We may have 4 the next time.
Okay. And we'll plan on.
But I won't include 4. If 4 of them are normal the next time, I'll just include 1 or any abnormal ones.
Thank you.
Right, I'll only include 1 or abnormal ones. I promise.
So Cashin's and Associate Air Quality Report will be on the agenda next month. The next item on the agenda is the departmental divisional reports and updates from the HHS Director Golden.
This was passed out the last time. This just wasn't in the packet, so that's why it's here. So just in case you had any changes to it.
I thought it looked good.
Thank you. There's a team working on it, so there's someone from at least one person from each division, including Matt from the health inspectors working on it. So there's a team.
Looks good. Anything else, Madam Health Director?
Did you have any questions on the Department of Divisional reports?
I did have one question. On the Board of Health Substance Abuse and Prevention Division, Lowell Health Department, on the first page under Lowell Co-op Overview, it says, the last bullet says, on February 24th, the co-op team did various things. And the first bullet says, the co-op team provided inpatient detox treatment services to 16 clients. Should that be the co-op team referred 16 patients to detox treatment? I'm guessing they didn't actually provide inpatient.
Hang on, I'm kind of lost as to where you are.
So first page,
Oh, here. Provided inpatient detox treatment services to 16 clients. It must be referred,
okay.
yeah. Referred. Because they don't, they don't.
Just the
Yeah.
clarification, they may want to, it sounds like
They
they,
refer to detox, they don't, yeah.
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 Because the other two bullets are referred. The first bullet says, provided inpatient treatment.
We'll fix that for the packet.
I'm just a stickler for these details. Okay, any questions on the departmental and divisional reports?
And just for a note, we do have in the school health packet at the top, the immunization survey. I don't know if we talked about that. Oh, sure, go ahead.
Just on the grant that you decided not to, that you canceled.
Oh, the PEC grant. The
Yeah.
SOAR PEC went to PEC grant, yeah.
So just real quick, why was that no longer consistent with the department and community's needs and goals?
Okay, so that grant is for preschool age children, and we've had it for the last, I believe, 3 years, and we've been unable to get families to engage in that. And it's the way that they want us to do it is to have like play groups of children to do it, and we've been unable to get people to engage and do it. And we've also had a difficult time having someone been employed in that, and the person who had that job ended up going to the Mass Call 3 grant, which has been very successful for middle school and high school age. And now we would be getting the grant from now until June, and hiring someone for 6 months on a grant position, and then not knowing if the grant would be successful moving forward as a federal grant would be very difficult. So we opted not to do that.
Thank you.
You're welcome. So at the top of the school health unit is, I know there's a lot of talk about the measles case that was in Texas, and then immunization rates. So our immunization rates that we put in from the school is at the top of the school health unit for the compliance rate of 96.8. So that is here, and the rationale behind why that rate is here, Beth did put that on here when they put their rates in for the schools. And then I did pass out the information, which is on Facebook and a lot of social media. The Unwanted Medication and Sharps Day will be next Saturday, the 15th, at the Senior Center on Broadway Street from 10 to 2. It'll be a drive-through. You can just drive through, hand out your Sharps and your unwanted medication, and you don't even have to leave your vehicle.
So that's Saturday, March 15th from 10 to 2. Right? Anything else?
Nope, I'm good, thank you.
Any questions for the board, comments?
Nope, thank you.
Do we have a motion to adjourn?
Certainly do.
Thank you. All those in favor? Aye. Meeting adjourned.
You're actually getting good at this.